Post-traumatic stress disorder, PTSD, is a mental health condition that can affect anyone who has experienced or witnessed a traumatic event. From military combat to personal trauma like abuse or accidents, PTSD impacts millions globally, disrupting daily life and emotional well-being. Understanding PTSD involves recognizing its symptoms, such as flashbacks, avoidance, and heightened anxiety, while also exploring its causes, including the brain's response to extreme stress. Early warning signs like persistent fear, emotional detachment, or sleep disturbances can help identify the disorder early, enabling timely intervention. Raising awareness about PTSD is key to supporting those affected and fostering recovery. Today we will talk about understanding PTSD, symptoms, causes, and early warning signs. So, before we start, make sure to hit the like button and subscribe to my channel. What is PTSD? PTSD is a mental health disorder that develops in response to a traumatic event, overwhelming an individual's ability to cope. While occasional stress reactions are normal after a distressing experience, PTSD occurs when these reactions persist for weeks, months, or even years, disrupting daily life. According to the American Psychiatric Association, PTSD affects approximately 3.5% of adults in the United States annually and is more common in women than men. The condition is not a sign of weakness but a physiological and psychological response to extreme stress. Symptoms of PTSD manifests in various ways, and its symptoms are broadly categorized into 4 groups: intrusive thoughts, avoidance, negative changes in mood or cognition, and hyperarousal. Intrusive thoughts. Individuals with PTSD often experience flashbacks, nightmares, or intrusive memories related to the traumatic event. These memories can feel so vivid that it seems like the trauma is happening all over again, triggering intense emotional and physical distress. Avoidance. People with PTSD may go to great lengths to avoid reminders of the trauma. This could include steering clear of certain places, people, or activities associated with the event. Over time, this avoidance can lead to isolation and hinder recovery. Negative changes in mood and cognition. PTSD can significantly alter how a person thinks and feels. They may struggle with persistent negative thoughts about themselves or the world, lose interest in previously enjoyed activities, or feel detached from loved ones. Guilt, shame, and feelings of hopelessness are also common. Hyperarousal. Hypervigilance is a hallmark symptom of PTSD. Affected individuals may feel constantly on edge, have difficulty sleeping, and be easily startled. This heightened state of arousal can lead to irritability, anger outbursts, and difficulty concentrating. Causes of PTSD. The causes of PTSD are multifaceted, involving an interplay of psychological, biological, and social factors. Traumatic experiences. Any event that threatens a person's sense of safety or causes extreme fear can trigger PTSD. Common examples include military combat, sexual or physical assault, car accidents, and natural disasters like earthquakes or hurricanes. Biological factors. Research has shown that PTSD is linked to changes in brain function, particularly in the amygdala, responsible for fear responses, the prefrontal cortex, which regulates decision-making, and the hippocampus, involved in memory processing. Elevated levels of stress hormones, such as cortisol, may also contribute to the development of PTSD. Genetic and family history. Individuals with a family history of mental health conditions, such as anxiety or depression, may have a higher risk of developing PTSD. Genetic predispositions can influence how someone reacts to and recovers from trauma. Personal factors. A person's coping style, resilience, and prior mental health can also affect their susceptibility to PTSD. Those with limited support systems or pre-existing mental health challenges may be more vulnerable to its effects. Cumulative trauma. Experiencing multiple traumatic events over time, such as ongoing abuse or repeated exposure to violence, can increase the likelihood of developing PTSD. This is often referred to as complex PTSD, CPTSD, a subtype of the disorder. Early warning signs. Recognizing the early warning signs of PTSD is essential for timely intervention and treatment. These signs often appear shortly after the traumatic event, but may take months or years to surface in some cases. If someone continues to feel extreme fear or anxiety long after the traumatic event, it may indicate PTSD. Frequent nightmares or difficulty sleeping can be an early indication that the trauma is affecting an individual's mental health. A person may start to feel emotionally numb, detached, or disconnected from their surroundings and loved ones. Consistently avoiding people, places, or activities that remind them of the trauma is a strong early sign of PTSD. Sudden anger outbursts, irritability, or an inability to control emotions may suggest that the individual is struggling with unresolved trauma. Physical complaints such as headaches, nausea, or chest pain without a clear medical cause may also signal PTSD, as the mind-body connection plays a significant role in trauma responses. How PTSD affects daily life. Left untreated, PTSD can significantly impact various aspects of an individual's life. Relationships may suffer as the person withdraws emotionally or becomes irritable. Workplace performance can decline due to concentration issues, absenteeism, or conflicts. Additionally, those with PTSD are at a higher risk of developing co-occurring disorders such as depression, substance abuse, or chronic pain conditions. Treatment options. Fortunately, PTSD is treatable and recovery is possible with the right approach. Treatments typically include a combination of therapy, medication, and lifestyle adjustments. Evidence-based therapies such as cognitive behavioral therapy, CBT, prolonged exposure therapy, and eye movement desensitization and reprocessing, EMDR, have shown remarkable success in treating PTSD. Antidepressants like SSRIs, e.g. sertraline and paroxetine, are commonly prescribed to help manage symptoms of PTSD. Connecting with others who have experienced similar traumas can provide a sense of community and understanding. Regular exercise, mindfulness practices, and a healthy diet can complement other treatments and enhance overall well-being. This approach ensures that all interactions with healthcare providers are sensitive to the effects of trauma and prioritize the individual's safety and empowerment. The road to recovery. Recovering from PTSD is not a linear process and varies from person to person. While some may find relief within months, others may require years of ongoing treatment. Patience, support, and professional care are critical components of recovery. Loved ones play a vital role in the healing process by providing understanding, encouragement, and a non-judgmental space. If you liked this video and would like to see more like it, please give it the thumbs up, leave a comment, and click the button to subscribe.